As America tackles the difficult job of healthcare reform, many have embraced a new team-based model of patient care, the patient-centered medical home. Endorsed by primary care groups and the AMA, patient and employers groups, and the insurance industry, the patient-centered medical home is designed to provide the right care at the right time, at the right cost, and in the right setting.
The model works for both the patient and the employer because the model provides better access for the patient, better access in terms of productivity for the employer, and a much better, more robust primary care and prevention, which serves everybody better.
This is a model that has been proven that it can decrease the inflationary cost of health care and deliver far better outcomes, keeping patients at home, out of the hospital, out of the emergency rooms.
For the private sector, facing today's skyrocketing healthcare costs and an economy in recession, the patient-centered medical home has become more than just a good idea. It's become a top priority.
But I think the private sector has to actually be the leaders of implementing the reforms that we need.
Addressing the health care component of labor cost, which is the biggest component of the cost of the delivery of products and services in industry, it's an urgent life or death matter.
Does this model really work? Numerous studies say yes, and ongoing medical home pilot and demonstration projects across the country are proving it. The Geisinger Medical Home, for example, operates completely within a closed system where the health plan, health system, and physician workforce are all part of the same organization.
It was the right thing to do for patients. It was the right thing to do from a doctor and a provider standpoint. And at the end of the day, it's been the right thing to do for the business as well.
Another project, organized through the office of Pennsylvania Governor Ed Rendell, involves a large number of independent medical practices and multiple insurance companies.
That was a very important breakthrough because insurance companies can't sit and talk together about how much to pay doctors. That's an antitrust problem. They're not allowed to do that, even if their intentions, as they were in this case, were excellent in trying to increase primary care reimbursement to create extra capacity in primary care. They still couldn't have sat down and all agreed on a strategy for doing that. So the governor's office was very important in getting this off the ground.
An ambitious new medical home pilot has gotten underway right here in Georgia, a collaboration between Wellstar and Humana.
With medical home model, what you're really doing is creating an environment where you can have very safe, timely care, as well as efficient and equitable collaboration, partnership, and coordination. And that's what's so exciting for us, is that we're able to take the partnership with Humana and change information streams into knowledge to maximize and optimize the patient care outcome.
Short term, we believe that we will see improvements in unnecessary ER use. Obviously, if a member needs to go to the emergency room, they absolutely should. But what is bad is when people are going to the emergency room because they don't have any way to get into their personal physician, they don't think they have a personal physician, or they get a voicemail after 5 o'clock Friday saying, if you have a problem, go to the local emergency room. Not the right thing to do to the member, and it does increase costs in a way that's unnecessary. So by virtue of doing a better job on all of these pieces, we believe that we can reduce costs, we can reduce fragmentation.
Can patients who have a medical home really tell the difference in the care they receive?
Getting back to a model that is partner-based, as they like to say, where you have someone that knows you, that you can share in an ongoing way with, who can address the issues over time with you to make sure that they're not escalating into other problems. What do you think?
Yes, I do think that this should be, any person in the United States should have this program because it saves time, it puts the person at ease that's calling, and I think it saves Medicare money. I really do think so.
It's good care, and it's always good to have a physician that cares.
Better access to physicians, better outcomes for patients, lower healthcare costs, and higher quality healthcare for all Americans. This is the promise of the patient-centered medical home. And so far, we're learning that this promise is being kept. Ask your doctor about the patient-centered medical home.